Hello everyone. Welcome to my second video of Fat to Living. In this video I'm going to talk about making the decision to have weight loss surgery. Now, there are the three types out there. There's the lap band, the gastric sleeve, which I have, and the gastric bypass. Now, obviously my expertise is going to be more in the gastric sleeve than in the other two, but it's still all relevant. Now, when you decide to make this decision, this is clearly one of the most important decisions that you can make in your entire life. Because what you're deciding to do is you're deciding to change your life. You're deciding to live a healthier lifestyle and accept everything that's come before in your life. You're willing to accept your failures and your struggles of having this eating disorder. Because that's ultimately what it is. It's an eating disorder. We are addicted to food, people like you and me. We are all addicted to food. And people question that how can you be addicted to food when you need food to live? And I understand that. And I agree with that statement, that it is a little weird to say that. But ultimately, you need food to live, but you don't have to live to eat. You can live for many, many other things in this world. There are much better options out there and much more exciting things out there in your life for you to accomplish and to see. So, when coming up with this decision, I mean, obviously, this is number one most important thing I can tell you is that you personally have to be ready for this. Nobody can force you to do this. No one, not your friends, not your family, not your doctor. They can all suggest it to you that they think this is the right course of action for you, but ultimately it is your decision. And it's a good, so after you've come to the personal choice, obviously at this point, your doctor's probably suggested it, maybe a family member or two, or a couple friends, or people you know that have had weight loss surgery. Have suggested it to you. So you get to that point. So really at that point, once your doctor or someone suggests it and you accept that this is what you want to do, then you need to start doing your research. You need to know the three types of surgery. You need to speak with your regular general doctor about which surgery is probably best for you. And hopefully your doctor will be able to steer you in the right direction or steer you towards a well-respected and well-known weight loss bariatric surgeon who then will definitely be able to help you and give you the information that you truly need. That's really ultimately what it comes down to, is just, speaking with your doctor and hopefully having him guide you towards the right surgeon. Once he gives you a suggestion of maybe one or two or three different surgeons, because there are many bariatric surgeons out there, what you need to do for yourself, you need to do your own research. You need to look up these surgeons. You need to meet with these surgeons, schedule appointments with them, because you want to find someone that you're comfortable with. You don't just want to look up on the internet or in the phone book or whatever the first bariatric thing that pops up. Nothing against any of those doctors, but really you want to do your own research because it's your body. You're making this decision, so you want to make sure that you're comfortable with every step. You want to be comfortable at every level, every step that you take throughout this journey. You want to make sure that you made the right choice. And picking the right surgeon is a very, very important part of this entire journey. Now, once you pick your surgeon and you meet with him, obviously, he'll discuss with you, your medical history on with that, and he'll guide you towards which surgery he feels is best for you. Each surgery is different, and each surgery is different for each person, depending on your weight, your age, your other medical issues. It could be a variety. It really is. Every person is different. And you're going to have to learn that, and we'll guide you towards the correct procedure. Now, once you do that, once you meet with the surgeon and you've finalized which surgery you're going to go with, and that's all completed, your next step is obviously to, go through your insurance protocols, or, how you're going to pay for this and everything, because it is expensive. It's worth it, but it is expensive. And also, you should consider speaking with a nutritionist. Uh, Most surgeons will have a nutritionist partnered with them to help patients, and they'll help you develop better eating habits, and they'll start giving you ideas of what you're going to be looking at after surgery, post-op, and the timelines, and uh, slowly going back into certain foods, and basically relearning how to eat. You're almost like a toddler, where you're eating mush in the beginning, and you slowly are increasing and working your way towards different foods. So you meet with a nutritionist, and like I said, they'll be able to set you up and help you and explain all the different things that you're gonna have to start to experience. Another thing, definitely, really should be looking into this, speaking with some kind of psychologist or therapist, because ultimately we have a disorder and we have a sickness in our minds. Um, I don't care if people feel that what I'm about to say is a terrible analogy, but in my opinion, this is really what it's like. We are addicted to food like drug addicts are addicted to their drug. Food is our drug, and we crave it. We will find any way possible to get what we want. And a lot of that you really should speak to some kind of mental health professional to get an idea of where you are mentally, and get an idea that so that you are mentally understanding the change that you're making to your life. Because understand this, you're never going to be able to eat the foods that you eat now in the portions that you eat. You'll never be able to do it again, ever. It will be nearly impossible to do it. Theoretically, yes, you can do it, but the side effects would be massive vomiting and just utter complete failure of the surgery and the entire journey. So I don't understand why you would want to do that. So definitely speak with a mental health professional, and they will help you, gauge your mindset, and help you to work out your issues. Maybe you deal with more depression than someone like I did. And there's nothing wrong with that. But they will help you, come to terms with everything, and to face all this. It's like a journey. So, with all that being said, this is obviously a pre-op video. So hopefully now at this point, you've made the decision to have surgery. Out of this journey is that you personally are ready to make this decision. You've spoke with your doctor. You found the right surgeon, someone that you're very comfortable with, and that understands what you're looking for, and you understand all that you're about to do to your body and to your mind. You've hopefully understand that you need to speak with a nutritionist who will help guide you on the correct foods, and through your, especially your first couple months out of surgery is very, very important, extremely important to have a nutritionist to help guiding you, and a mental health professional just to help you mentally prepare yourself for the massive changes that you're going through in your life. So good luck. I hope you enjoyed this video. I'm going to try and work and get better and better in each video, and I'm going to try to get them up more often. So I hope to see you guys in the next one. Until then, good luck, friends.